Good results were seen when venous disease-causing leg ulceration was treated with early endovenous ablation of superficial venous reflux as an adjunct to compression therapy, investigators reported. Patients had their leg ulcers heal faster if they got compression therapy and were randomized to endovenous ablation of the reflux within 2 weeks instead of waiting to ablate until after the ulcer was healed or 6 months had passed. Healing time 56 days versus 82 days, adjusted HR 1.42, 95%, C 1.16 to 1.73, according to Alan Davies, DSc, of Cambridge University Hospital's NHS Foundation Trust in England, and colleagues. Results of the early venous reflux ablation (EVRA) trial were presented at the International Charing Cross Symposium and simultaneously published online in the New England Journal of Medicine. By week 24, 85.6% and 76.3% of the early and deferred intervention groups had healed ulcers. Among those whose ulcers had healed within 1 year of randomization, the rate of ulcer recurrence trended lower with early intervention, 0.08 more events per person year with delay, 95%, C-0.02 to 0.18. Ultimately, early intervention let patients enjoy 306 days free from ulcers after randomization, versus 278 days with deferred ablation, p equals 0.002. In the current trial, we found that faster ulcer healing can be attained if an endovenous intervention is performed promptly. This benefit was observed despite the provision of high-quality compression therapy, which might explain the good healing rates observed in both treatment groups, the authors said. Such effective compression therapy is probably not commonplace outside randomized trials, which may help explain the much slower healing times seen in the real world. Accordingly, improvement in ulcer healing with early endovenous intervention is likely to be greater in clinical practice than was observed in this trial. Because endovenous intervention is usually performed as a single procedure, the clinical benefits are likely to be less dependent on ongoing patient adherence than they would be with compression therapy, Davies' group suggested. EVRA was conducted across 20 centers in the United Kingdom. From 2013 to 2016, 450 patients were randomized to compression therapy and early ablation of superficial venous reflux, N equals 224, or compression therapy with ablation deferred if performed at all, N equals 226. Venous ulcer, vein, leg ulcer. Read full story. More health.